Now, this whole area of regulation is quite difficult. If the government want to pursue a market in healthcare, which they do, and they want to expand that market, introduce more competition, potentially more private providers and so on, and change the nature of that competition to an extent, it's clear that we need some regulation. Regulation in terms of quality. This is about consumer protection, protecting patients and so on. And also regulation about the whole economic environment. One of the issues with healthcare is that it is a market, but it's not really a market like telecoms or water or electricity, where there are also national regulators. Now, we think there are quite a few questions we need to ask right at the outset about regulation. A crucial one, a rather simple one, is how many regulators should we have? It looks like the government's going to go for the CQC to regulate, in a sense, quality, and that's going to cover all healthcare providers, public and private. And that's really about, as I say, about a sort of consumer protection issue. And it's in part about ensuring good performance. And then on the other side, we're going to have an economic regulator. So it looks like we're going for two, and it seems like that could be sensible. We could have gone for one amalgamated regulator, but I think going for two is probably fine. Which organisations are actually going to have to hold a licence in order to provide healthcare, or even commission healthcare? Should it include all NHS hospitals and foundation trusts? Should it include the private sector who are supplying healthcare to NHS commissioners? Should it include commissioners, in fact? And what about general practice? They're also providers of healthcare, and dentists and so on. So there are some significant issues here, and the government are proposing what they propose, which is really to limit the licensing and the regulation to, well, it's a bit confused and muddled, and we point this out in our consultation. There needs to be a lot of more clarity around this issue. But essentially, it's limited to providers of NHS services. Now, that may or may not include the private sector, but that's a crucial area to get right and to be clear on. The proposal is for Monitor to have the job of setting prices in the system. At the moment, the Department of Health issue a list of prices, fixed prices for the year for all providers. That's not going to continue. It's going to be Monitor's role to do that. Now, there are two things, crucial things here. One is that Monitor needs to have clear objectives about why it's setting prices and what it's trying to achieve. So, is it trying to achieve greater efficiency in the system? Is it trying to achieve some sort of level playing field between different hospitals and so on? Another issue is whether there's a role for the regulator in competition policy. Should the regulator, for example, be promoting competition between providers? Or is it okay sometimes just to have a monopolist providing care? And the NHS has developed over the years in a sort of local monopoly, because that's it makes sense to do that economically and on the grounds of efficiency. And just finally, and a crucial one is, to what extent should a regulator have a role in rescuing or intervening when a provider or maybe a commissioner gets into financial distress or even fails financially? And you can see clearly there that there may be a role. One of the objectives of the regulator could be that it needs to, and the government do propose this, that it needs to ensure that services carry on in the event of a hospital going bust, to put it crudely. There is an important balancing act that the regulator is going to have to get engaged in terms of how does it support services and which services are most important to support. Do we need accident and emergency services everywhere and easy access? I think the answer is yes. Should the regulator be involved in supporting those services, even if, for example, a hospital wanted to close down a service because it was making a loss? When it comes to the private sector providing healthcare, NHS care, to what extent should the regulator have powers over the independent sector? And the government do propose that the regulator Monitor works with the Office of Fair Trading, and there's an existing law about competition law and so on. But again, this is new territory. This is new stuff for the health service, and I think we're going to have to move somewhat slowly here and feel our way. And as it is almost experimental in some ways, there's a real need to be quick to spot mistakes and then to rectify them.